You know, it used to be that people thought they had to travel to the top centers in the country to get their cancer treatment because that's where the technology was. The Mohawk Valley Health System has that technology now. We have arguably the most advanced cancer fighting system in the world, and that's the Varian Edge. It gives us the ability to treat any type of cancer that needs radiation treatment. In the past, we've always had the ability to treat radiosurgically, and radiosurgery is the use of a radiation beam to produce what a surgery would be, but without a knife. The problem has always been, can you treat that tumor to a high enough dose but spare everything else around it? This machine that we just purchased is now giving us the ability to be accurate to within a half a millimeter. That's the size of a human hair. And so it allows us to treat cancers now in places of the body that we could never treat before, and we'd have to send patients out. We know with certainty now that we can treat that cancer to a dose that's going to kill it, but still spare the healthy tissue that's around it. And another benefit of this is our field in general is moving towards higher dose treatments, less treatments. The accuracy inherent in this machine is giving us the ability to do this and take these patients to higher doses and get them treated much faster. And another benefit of this is the treatment time. In the past, it's usually taken 15, 20, sometimes an hour, hour and a half to treat a patient. This machine allows us to do the same type of treatment in possibly 7 to 10 minutes. The machine goes around you, you hear it, but you can't feel anything. And then you walk out in the afternoon, you're playing golf, you're having a nice afternoon with your family. And convenience is one thing, but when you have a patient that's hurting, it's hugely beneficial to be able to treat that patient quickly. One, because it gets them out of pain faster, but two, because anybody who's in pain can't hold still. And if you're asking a patient in pain to hold still for an hour, they're going to move. When they move, the accuracy of your treatment is degraded. In this scenario, if we can get them to hold still for 7 minutes, 5 minutes maybe, we can get the treatment done much more quickly, which gives us a much more accurate treatment to treat them. And here's another thing, when it comes to treating cancers of the brain, we have a system now called OSMS. In the past, to assure accuracy of treatment, we would take a frame, it would literally screw into their head would lock to a table. The new system we have allows us to treat these patients without screwing anything into their head anymore. It's a non-invasive surgery of their brain. And it allows us to do this by taking 3 cameras that are in the room. They project over 3,000 data points on this patient's right around their face, and it's watching their face for movements. And it's accurate to within 1/10 of a millimeter and 1/10 of a degree of rotation. And if anything changes while this patient's being treated, the machine is going to turn itself off until the patient gets back into treatment position and the machine determines it's okay for them to treat. And the end goal is we need to treat them safely and effectively. You can't do that any better than you can with this machine. So we've got a regional cancer center in upstate New York that has arguably the best cancer fighting system in the world right now. One of 13 places in the world that have this system, and the nearest comparable technology is roughly 4 hours away. Part of cancer therapy and part of the recovery process is being around people you love while you're going through it. Having this technology is immense to the healing process. You can stay right here in Utica, New York and get your treatment and know that it's as good or better than anywhere else in the world. And it's right here in the Mohawk Valley Health System.